I have always been a very physical person, very active person, have always taken or had a great deal of confidence in the fact that those things would keep me healthy and slow down the aging process for me. For the past year, I really haven't felt like myself. I sort of felt out of control. I felt like I had no control over my life. I know I'm getting older, and I understand that, accept that, but truly, I have had sort of an unexplained weight gain that I didn't feel I wasn't able to control my normal way with the same eating plan and exercise that I'd always done. Late in the day, I had no energy level. I was losing hair. My hair was coming out. I really think I lost interest in all of the activities that I had enjoyed before. Shopping, going out for lunch with the girls, a movie, out to dinner with my husband. All of those things just suddenly seemed rather meaningless. I think that any normal person is going to fear aging because all of the things that you've known about yourself since the day you were born suddenly change. You just feel that you're losing the ability to do the things that you've done in the past. And you know, I mean, intellectually, you know that's going to happen. But emotionally and how you relate to your physical being is very difficult. I wasn't looking myself, I wasn't feeling myself, and I knew that I had to do something about it.
Everyone, please welcome Jaybird Cook along with Dr. Richard LeConey from the Institute of Anti-Aging. So I think it's very interesting to, first of all, look at you and see how gorgeous you are and young you look.
Thanks.
But apparently inside you just were not feeling that.
I really wasn't. And I had been dealing with that for quite some time, ever since I went through menopause and had a hysterectomy about 5 years later. I had a little low-dose estrogen patch. And then about, I would say, a year ago, I just had this unexplained 15-pound weight gain. I was so tired. I mean, just unbelievably tired. And really, I guess to sum it up, I had just lost my joy. The things that I normally enjoyed doing, I just could have cared less.
Joy and mojo.
And mojo.
Apparently.
And no sleep. You know, night sweats, not sleeping, all of those kinds of things.
No, but what is, this is kind of what I wanted to address with you. Now, I want to talk about what happened now, because apparently, I mean, you look amazing, but you feel amazing now. And
I do.
And you did something called natural hormone replacement therapy.
Bioidentical natural. They're somewhat similar, yeah.
So what is that exactly? Well,
it's using hormones identical to the hormones that your body made before you had menopause. So that's why they use the word bioidentical. It's still estrogen.
Okay.
And it's progesterone, but it's the real progesterone, the one that your ovaries made, as opposed to a progestin, which is synthetic and is actually quite a different substance. It's what they call derivatized. The pharmaceutical companies change it a little bit for certain purposes. And so natural progesterone is the one you made, it's the one your ovaries make. Why not use it?
Right.
It works.
Well, and you started using it. You put Jaybird on this immediately.
Right. Exactly.
And after you heard her symptoms of these, one thing I wanted to touch on is, how do you know the difference between her symptoms and just, you know, getting tired, not being as active, growing older?
Well, you know, certainly that's part of it, you know, but I think when a woman has menopause, she will see a very distinct kind of a change. I mean, this is a quantum change, you know. Yes, you know, there's a gradual, you know, loss of energy and drive and that kind of thing, and vitality that goes with getting older. But when women go through menopause, they'll tell you that's an event. It's like going through a door. That's, you know.
Don't turn back.
You won't mistake that for just the gradual change of aging. And that's when, you know, hormone replacement, whether it's bioidentical or otherwise, comes in. Obviously, you know, doctors have been doing this since the 60s.
Right.
Because women demanded it. When they went through this, you know, they went to their doctor's office and grabbed them by the collar and said, do something.
And it was like 80% or 90% ease the symptoms. And I've heard that just the stress of that alone, of all the symptoms that come along with menopause, can cause coronary heart disease, all of these
Certainly
different...
it doesn't make it any better, right. Absolutely. A lot of adrenaline in the system, a lot of anxiety, a lot of stress. I still think progesterone is kind of almost the magic ingredient in this, and the natural bioidentical progesterone.
See, that's what we're going to talk about in the next segment, the difference between the natural bioidentical one and then
It gives women a stress
what the
tolerance.
patch doses. You had the estrogen patch.
I did a low dose estrogen patch,
but it wasn't helping.
But after a complete hysterectomy and a discussion with my gynecologist about that, who said no, it's fine, you don't need anything else. It wasn't fine. It just gradually got worse and worse until it was very profound. It was within a 6-month period of time.
But you did the natural thing. You figured you were probably going through menopause. You went to see your gynecologist. You got put on the estrogen, and that's what most people do. But that's why we're going to go to break now, but we're going to come back and find out what most people who go to Dr. LeConey do and how much better you're feeling. So you're staying with us. Stick with us. We'll be right back. You got to find out about this.
Coming up, we're continuing our discussion on hormone replacement therapy. It can benefit women greatly, but what about the controversial side effects? We'll tackle those issues next.
Welcome back, everybody. Well, this is just a reminder, send those emails if you have any questions regarding your children's vision. We're going to be answering them for free. Coming up on the air, we'll have an ophthalmologist here from Kelsey-Seybold. So, get them in. Great Day Houston right there at khou.com. But let's get on with this talk about hormones. Hormone replacement therapy, you probably heard it in the news. It can help many people out, but it can do more harm than good. It's a good question to ask. I don't know. We're going to find out. To help us answer those questions, please welcome back Dr. Richard LeConey and his patient, Jay Bird. First of all, in the break, we were discussing using all of these different products, and Jay Bird, you said I have a virtual pharmacy in my bathroom. But what do you do? You wake up and you do what?
Well, I have an estrogen cream that I apply on the inside of my arms. I have a testosterone cream which is applied on the thigh, and I have progesterone capsules, which I take in the morning and in the evening. The estrogen is a morning and an evening dosage as well.
Now, the reason why you do this rather than just slap on the estrogen patch, if you're just joining us, Jay Bird said that it didn't make her feel any different, didn't make her feel better. So you saw Dr. LeConey, just catching people up on this, and Dr. LeConey recommended this more natural way. And in the break, we kind of said it's the difference between going to Whole Foods and getting the organic, chemical-free broccoli, and then going to, another store and just getting the regular broccoli. Well, it's got the same thing in it, but there's chemicals and things in the stuff that you can get from these major pharmaceutical companies. And yours, you say, is chemical-free, or of the chemicals that don't need to be in it free.
And it's identical to the same estrogen that your ovaries made or make. Same as with the progesterone. It's the bioidentical progesterone that your body makes during your fertility cycle. And so, and the other convenience factor is that these are better. This is a form that's easier to use than some of the transdermal creams and or patches. It has a little bit more in it, so it gets you a better effect. Some of these can be combined. Once you've been on this for a while and your dose is established, you can combine these into one for more convenience.
Well, let's talk about, these are the different forms of treatment. The estrogen pills and, as you said, the skin patches, which is what Jay Bird used, and the creams, which are showing. But the difference between what you have and you're a physician and what you could get, what you were getting, is what exactly?
Well, this, of course, is, again, the bioidentical. It's the same thing that your ovaries made. Many of the estrogen forms that are prescribed and available through conventional pharmacies like your Walgreens, CVS, those kind, they're derivatized. They're slightly different. They use different add-ons to the molecule that give it certain effects that sometimes are undesirable. They may do that to make it last longer, so you only have to take one dose a day. But there's a trade-off for that.
What are some of the side effects? Because Jay Bird, you said you had some side effects on the estrogen patch.
Well, I think it wasn't so much side effects as it was just that it wasn't doing anything.
The side effects were, I still have menopause.
Zero. Yeah, exactly.
I'm still not sleeping.
So, I mean, the natural bioidentical for me, it very simply, it was results. With aging, it's a process, it's a journey. You've got to do your research. You've got to do something. You can't just sit around and say, oh, well, okay, I'm getting old.
Right.
So I'm going to just sit around and do nothing about it. So, I think you have to be very proactive. You have to be a participant in your own wellness. It's just really important.
And so,
some of the side effects would be bloating, swelling, breast tenderness, some of the same side effects that women